But as far as the treatment, everyone unanimously obviously is sleeping better. Also getting up in the morning without all the trouble that they used to have. Everyone's definitely looking brighter and younger. Patients are telling me they're losing weight, their jawline is slimming. As a result of that, obviously, we're going to get less tooth decay. Mood is better.
So it sounds like everything gets better.
Everything just falls into place. It's like our bodies were meant to be healthy.
Yeah, it's like the default is health.
That's the default, and we're just bringing them back to nature, basically.
So we're here with Dr. Hyun Bang, who's a personal friend of mine, and she's a dentist, but she's a very special dentist. Hyun is what we call a airway-centered dentist. You've probably never heard of that before, but we're going to discuss how dental problems and specifically issues with your airway, your oral cavity, can be linked to a lot of the health issues that people are dealing with, such as insomnia, such as chronic pain, even mental health issues like anxiety and depression. And we're going to get into it. But first of all, Hyun, thanks so much for being here doing this interview.
It's my pleasure.
If I could just throw out like a nutshell statement, is there a link between your oral airway, poor dental health, and things like insomnia, chronic pain, depression and anxiety, weight gain or inability to lose weight?
Yes, in the sense that they all stem from the same problem. And the common core problem would be the narrow jaw. So we're, as dentists, looking at the orofacial complex.
Yeah.
And we're checking for cavities and gum disease, but airway-centered dentists go beyond that and look at the anatomical structure of the jaw. And so if the jaw is narrow, the airway is narrow.
Okay.
Yeah, and so if the airway is narrow, we're going to have a little bit more difficulty breathing. Mm-hmm. Of course, we adapt to that, but especially at night, we will end up suffering a lot more. And then we see manifestations of that in, multiple dental diseases that we see, tooth decay, gum disease, various issues, tooth fracturing. But we also see the medical issues like what you have just listed, and many, many more actually.
Wow.
Yeah. Mm-hmm. But 9 out of 10 people in America have things like depression, anxiety, weight issues, cardiovascular, diabetes, thyroid problems, ADD, ADHD, infertility problems, insomnia, chronic pain. Those things are very prevalent, and we're finding that these people have that same narrow jaw.
Sleep issues, insomnia, just poor quality of sleep. What's the link between poor dental health and airway-centered issues and sleeping problems?
So, as I just mentioned, when we have a narrow jaw form, that means our airway is also narrow as well. Mm-hmm. And people with a narrow airway will tend to have sleep disorder breathing, such as sleep apnea, where they're not able to get air to flow through either easily or at all. So we see patients who stop breathing multiple times throughout their sleep, or even if they are breathing, it's just not a sufficient amount of air and oxygen. Mm-hmm. And so then the brain recognizes that, and in order to keep our bodies alive, the brain is very, very intelligent, so it tells us to compensate. It tells our jaw muscles to do certain things like grinding, bruxing. It definitely will tell us to open our mouths and start to mouth breathe. And so a lot of these patients will have some manifestation of sleep disordered breathing, which in turn becomes a core cause of things like insomnia, chronic pain, weight issues, depression, anxiety. I mean, about 90% of patients with depression, anxiety present with sleep disorder breathing.
Oh, wow.
Yeah, and generally it's accepted as universal that psychiatric disorders come along with sleep disordered breathing.
Whether it's some form of insomnia or sleep disturbances, at the core of that, it could be a dental issue, poor dental health, a narrow airway, and so this might be something that people wasn't even on the radar.
Mm-hmm. So narrow airway causes people to mouth breathe, and if you're mouth breathing, you're not getting good quality filtered air through the nose. And if you're not getting good quality filtered air through the nose, then there's a lot of harmful pathogens just going down into your lungs. So you may be more prone to respiratory illnesses. Another thing that causes is dryness in the mouth. So you have kind of dirty air going in the mouth, and it's causing dryness as well. A dry mouth will be more acidic. An acidic mouth will have inevitably more dental decay and gum disease. And that's just one way it is harmful. And the other way it's harmful is that we're not breathing through our nose. And nasal breathing, and a lot of people probably don't know this, is extremely crucial to our health.
Yeah, it's news.
Exactly.
The mouth, the nose, so what? Air's getting in.
Exactly. So you can be getting air, but you could be lacking oxygen still.
Wow.
Yeah. So when we nasal breathe, the air passes through the nose and through the sinuses. And we form a very essential gas for our body, for oxygenation of our body, called nitric oxide. 80% of the nitric oxide that our body needs actually is supposed to come from nasal breathing.
I didn't know that.
Yeah.
Wow.
So I see patients in their sleep studies and their CAT scans where their lower part of the airway is wide open. Nevertheless, their oxygen saturation is still very low because the upper part of their airway up here is very narrow. That's where the jaw is, right? And so they're not efficiently nasal breathing at night, and they're compensating by mouth breathing.
Wow, so we need to nasal breathe.
We need to nasal breathe, absolutely.
And if you got structural issues with the oral cavity, at night when you go to sleep, you're not going to nasal breathe, you're going to mouth breathe, and then that's going to have problems with the amount of oxygen you get. And am I understanding this correctly?
Yeah. The nerve that helps us to smell. So the olfactory center of our body. So the olfactory bulbs, everybody knows it helps us, sense smell, but that is actually not its main job.
Okay.
It's not its main role. Its main role is actually to constantly stimulate our limbic system. Yeah, it's that emotional center. It helps with cognition. It helps with sense of empathy and things like that. Yeah, so if we are robbed of nasal breathing our whole lives or a good portion of our lives, then potentially our limbic system is not getting the proper development that it needs. So it can decrease our sense of empathy.
Wow.
Yeah, and that could lead to a slew of mental disorders as well, psychiatric problems as well, right? And so there is research done on children, and these are really extreme case scenarios. Children who have, obstructive sleep apnea as a child. We're finding that link in between children who harm animals. And there's research done on that, and the mouth breathing and lack of nasal breathing. Yeah.
Wow. So even violent behavior.
It can be associated. And there's definitely plenty of research done on childhood delinquencies with body weakness. So children who tend to be delinquent or, causing issues can oftentimes actually have some sicknesses in their body, and they tend to be weaker. And these are some of the older research, so they may not have actually looked at a sleep study. But if we had sleep testing available for these children, we may find a prevalence of sleep disorder breathing as well.
Wow.
Yeah.
We talked a little bit before about people having broken up sleep.
Yes. Fragmented sleep is what we call it.
Fragmented sleep, yeah. And that being linked to a narrow airway and things collapsing. And can you speak to that a little bit? How that's linked?
So fragmented sleep, short durations of sleep, these are all related to weight, insomnia, and things like Alzheimer's. When the jaw and the airway is narrow, then you're not getting proper oxygen flow, then the brain tells you to compensate. And every time the brain has to tell you to compensate, you're getting woken up from sleep, basically.
Yeah.
So you're only pretty much partially asleep. You're not efficiently falling into deep sleep, which is when, for example, our brain has a lymphatic system, and it's similar to our lymphatic system where it's the toxins draining and getting expelled from the brain. And that happens during the deep sleep, during the sleep cycle. And if we're lacking deep sleep because we're constantly disturbed because of airway issues, and your brain's trying to keep you alive, so it keeps waking you up, the lymphatic system is not able to, do its job, then we're getting toxins built up in our brain.
Wow.
Yeah, so that's going to be linked to things like Alzheimer's.
So one thing that is really fascinating to me, and I think might be fascinating to people watching, is that there is a link between poor dental health, narrow airway, and mental health disorders.
Yes.
So depression, anxiety, and you even mentioned Alzheimer's.
Yes.
So we touched on it a little bit, but can you just, again, break down what's the connection between poor dental health and mental health disorders?
So let's talk about general psychiatric mental health disorders. It's universal that sleep disorder breathing, sleep disturbance is prevalent in patients who have mental health problems. Yeah. For example, depression, anxiety. Depression, about 90% of patients are having sleep disturbance issues, and about 2/3 of patients who have insomnia, sleep disturbance.
That's huge.
Yeah.
Significant.
Yeah. And about 40% can't fall asleep or stay asleep properly. And I have patients who have those problems, and now they're getting at least a good hour or two extra sleep, and they're able to sleep through the night.
Wonderful.
Yeah, so the expansive treatments that we do is absolutely effective. It's essential to our health.
Yeah, absolutely.
And it's so essential, to be able to breathe properly.
This makes sense because, the brain thrives on oxygen. And the frontal lobe, where a lot of the mental health disorders are taking place. Right. And so if your brain is not getting nourished with oxygen throughout the evening, then that's going to, of course, negatively impact your mental health.
Right. And so now, you asked about Alzheimer's as well.
Yeah.
And we talked about, the body builds toxins. So when we have sleep disordered breathing, your body's going to have more toxins flowing through, circulating, because we're not getting the proper healing and repair. And that's going to cause, baseline of inflammation constantly without being fully resolved, because, our cells damage during the day and it's supposed to repair during the night.
Right.
But that cycle is not happening efficiently. Similarly, in the brain, we have a lymphatic system that drains the toxins and expels the toxins, but that activity is at its height during deep sleep. And not just any part of the sleep, but deep sleep, which is the time where we're being woken up from whenever we have airway problems. So the brain wakes you up from the deep sleep. And so if that's not happening effectively, then the toxins are going to build in the brain. And that's basically linked to Alzheimer's.
Wow. Fascinating, the chain of links. So this is something that having a narrow airway and poor dental health is something that's starting from our earliest time, from infancy.
Yes, from infancy, even in the womb.
Wow.
Yeah, because depending on the parents' health and what parents are eating and their lifestyle, the development of the baby has already started at the moment of conception.
Yeah.
And for example, a baby can be born with congenital issues like ties, lip ties, tongue ties, that makes it hard for them to breastfeed even if mom's really motivated to. And so now there's more knowledge about that, so more babies are getting those released so they can breastfeed better. But those are congenital problems that they're born with, so those things get passed down. So it really stems to our ancestry in the end.
Wow.
But yes.
People are probably like dying to find out. So what do you do? Like, what are these devices you're referring to? So could you just, it's probably, somewhat complicated. In a nutshell, explain, what do you do? What devices do you use? What are they doing in your patients?
The types of appliances that I use, we have what we call stem cell signaling, and that could sound sort of out of this world for a lot of people. And
yeah, fascinating.
Yeah, and the term stem cell has been thrown around so much, but it's basically something that our bodies already have. It doesn't have to be synthetically fabricated with rocket science in a lab for you to get stem cells. It's just something we're born with. Stem cells when we're young act as growth factors. Stem cells when we're older act as healing cells. So, when we're wounded and there's inflammation, it comes to help us to heal. When we're younger, it helps us to grow. But if you signal them just right, then it could actually help increase that that growth factor, basically. So osteoblasts and fibroblasts and all those blastic cells. So blastic cells, stem cells, mesenchymal cells, those are all kind of the same thing. And we're signaling them so that they can start to help us grow some bone in the areas we're kind of putting a little pressure and trying to expand and stretch out to. Literally, we get bone generation.
Wow.
Yeah.
So let me see if I understand this correctly. You're putting in devices that are removable for adults that actually physically, slowly but surely expand the palate, but at the same time will actually signal stem cells to come to the area and start to regenerate.
Yeah, so you're literally increasing the amount of stem cell activity.
Wow.
Yeah, and it's all
That's
natural too. It's not like there's a motor in there and like there's electricity or anything like that. It just uses your body's natural vibration. It's just made in a way where it can just kind of conduct it through these special springs that are in the device, and it conducts it through the teeth into the bone.
Wow.
Yeah.
That's fascinating. Now, I want to get into a little bit of like what you see. You've been mentioning it throughout, our discussion, but what are some of like the results that you're consistently seeing when you treat your patients successfully and you're able to expand their palate and open up their airway? What are the types of things that you're seeing happening?
Since I'm a dentist, the first thing I want to mention is that I see a decrease in plaque level in the mouth. Yeah, so just by decreasing the grinding and clenching that occurs as a side effect of the narrow jaw, decreasing the mouth breathing, increasing the nasal breathing, just the oral bacteria becomes healthier.
Wow.
Yeah, so we're seeing a lot less harmful bacteria, and as a result of that, obviously, we're going to get less tooth decay.
Yeah.
And because we're reducing the clenching and the grinding that happens as a side effect of narrow jaw, we're also reducing the trauma on the teeth. And reducing the trauma is going to contribute to less fracturing, less wear and tear, and also less recession of the gums. Yeah, so all of that kind of works in harmony. So that's definitely some of the results. In some cases, I actually see improvement in recession. Yeah, so it all kind of depends on your pre-existing and what's going to change. But there's the dental benefit there. Everyone unanimously, obviously, is sleeping better, less fragmented, able to sleep through the night, and also getting up in the morning without all the trouble that they used to have. Yeah, so there's that. Everyone's definitely looking brighter and younger.
Wow.
Definitely patients are telling me they're losing weight, their jawline is slimming. So it's really funny because I'm increasing their jaw in size, but then they feel like their jawline is slimming. And mood is better. Of course, in the sleep data that we see, deep sleep, REM sleep is better, oxygen, things like that.
Fantastic. So it sounds like everything gets better.
Everything just falls into place. It's like our bodies were meant to be healthy.
Yeah, it's like the default is health.
That's the default, and we're just bringing them back to nature, basically.
So cool.
It seems like it's the newest thing, but then at the same time, we're kind of going back.
Right.
Yeah, we're going back to nature.
We've kind of touched on it a little bit, but, if you think about how we've been degenerating really as a people and for the last 400 years, And a lot of the problem, if not the sole problem, was this nutritional degeneration. We started eating really poor quality, modernized food.
Yeah.
So would that imply that the way that someone at home could start reversing this on their own
Yes.
would be through nutrition?
Yes, absolutely. So I nutrition counsel my patients all the time. I spend a lot of extra time in the chair just on that. So since diet change to something really bad from something really good suddenly caused this drastic change, yes, absolutely, we can reverse this. So even if we're not getting all the structural, therapies that, I render for my patients, lifestyle is extremely important. So, our soil is very depleted in nutrition. And so even if we're doing all whole foods, organic diet, which I'm constantly trying to do, I'm fully plant-based, we just don't get the proper amount of nutrition density in our food. So how do we increase that density? I know you have this wonderful green powder, and it's the least processed you can find that is very easy to keep on the shelves, that doesn't go bad easily. Put it in your smoothies or mix it in some water and drink it. But that is definitely a great way to give a nutrition boost. But that's one thing, and I'm aware that not all of these supplements are going to be very high in nutrition per se, so really look at who's making it. I know that yours was nutritional value, when you've tested it, was equivalent to like a 16-ounce bottle of concentrated juice, for example. So something that is nutrition dense, that we're not stuffing ourselves with extra food, but we're getting the proper amount of dietary fiber, not overdoing that, but then the nutrition that goes along with it is also very, very dense. Soaking in sprouting could be one way to do that. Gardening your own vegetables.
Oh, that's the best. I think people could do that.
And from gardening, you get the sunshine, you get the fresh air, and getting proper vitamin D from the best source, which is outdoor sunshine during midday, when the shadow is a little bit shorter than your body. That's the best time to get the vitamin D, and you're going to actually get more from that. So those are some things nutritionally that I can kind of just touch on.
Well, that goes right along with my research. When I was able to reverse my cavities, what I found out, well, the thing that was shocking to me is 75-80% of my cavities I got while I was a plant-based vegan, not a junk food vegan either. And so that really was like a head scratcher for me. And what I ended, as I delved into the research, what I found was that that's a good basis, but it's not enough to get you past the line from survive into thrive.
Exactly.
And I needed some kind of a supplement to get me there. And the supplement, instead of like some synthetically lab generated, like 50 different pills, and I have like, every vitamin, but it's in its separate synthetic pill form, just getting it in its original packaging was the best. Plant. So juicing was a huge thing for me.
Absolutely.
But also nutritional powder, and that's why I created that nutritional powder. And it's having it be focused on all the vitamins and nutrients that are specifically needed, most important for building teeth.
Not only that, everyone's so busy. I diet coach, lifestyle coach my patients all the time, but there's really only so much they can do. And even for myself. So I do supplementation based on, I know when I'm not eating well, and I know when I'm eating well, like if I cook, and so it's really hard to balance. So the powder really helps, because juicing, I love juicing. And when I juice, like for example, if I bite my lip and I get an ulcer, it takes like 5-6 days to heal, when normally it would take over 2 weeks. So the green is definitely powerful. And so I would say go for the nutritional supplements, but the whole plant made into a supplement basically is the best. For
those that are interested, I'll have a link in the description to my my reverse cavity protocol kit, and the nutritional powder is part of that, and it could also be purchased separately as well, but the whole kit is obviously going to be more beneficial.
I was very impressed with that. at being your doctor. I
Yeah.
was very, very impressed. So yeah, this is definitely something that should be shared.
Yeah.
And everybody could just do this. And, you know, we try to put a price tag on things, but you don't get your enamel back once it's gone.
Wow.
Yeah, so don't damage it. And if it's getting damaged, just stop it right there and supplement that nutrition internally, not just topically. Like we put things on the teeth. I recommend bentonite clays and things with all kinds of minerals, like you know, diatomaceous earth that has silica. But internal boost is going to be extremely important. Our teeth are not inanimate hard objects.
Yeah.
It has pulp tissue inside of it, and a lot of people know that pulp tissue has nerve inside of it.
Right.
But what else it has that a lot of people don't know is blood vessels. So those blood vessels are carrying nutrition to the tooth.
Yes.
So yeah, that's the reason why you were able to reverse it. Yeah. So there you go.
And she, I remember you saw my X-rays, my before and after X-rays,
Yeah.
and
They looked beautiful.
yeah, and I think it's just affirming. People hear me say all the time, teeth can remineralize, teeth can remineralize, but I think it's so affirming for people to hear that from an actual dentist.
Yeah.
This isn't, you know, a crazy Gabe thing.
Yeah, so all dentists are going to recommend something to put on your teeth to remineralize, and it could be chemical. Some dentists who are more holistic are going to recommend more natural things like I do. But the internal is usually not addressed and even thought of as possible, but it definitely is going to make a difference because this whole problem started with diet. Remember that.
You got to address it from both.
From both angles, yeah.
Now, people are probably wondering, okay, I need to expand my airway, you know, I need to, you know, I want to move on this. What can people do now, you know, because here we are in San Francisco, California, at one of your offices here. People are watching this all over the place, all over the world, people are going to be watching this. What are some things that people could start doing today and maybe they could do, you know, a month from now to help? Practical things people could start doing. Consider
getting Gabe's nutrition powder, and I say that because I spend hours and hours and lots of energy and effort diet, lifestyle coaching my patients, but everyone is so busy. And I sometimes feel like I'm burdening them by giving them advice because now they have to add 3 more steps to their daily routine. And so really consider doing something like that. And if you have more time, then consider getting better quality grain. Try to reduce the whole wheat or the processed wheat or the whole wheat just because it's modern wheat. And modern wheat can do similar things to your body that sugar can do. So go with the more ancient, original grains, or even pseudo grains like seeds, like quinoa or amaranth. You know, ancient grains could be acorn, spelt, rye, things like that. And look at the ingredients of the bread that you're buying. I don't really like bread as much as just having the whole grain, so I'll have it as cereals or cook it as a rice or something like that. Have a healthier, just in general, if anyone is meat eating out there, you want to drain the fat and blood. That's the best way to consume meat. If we're consuming meat, of course, best quality and the grass-fed would be awesome. But still, the blood carries toxins throughout the body, and the fat stores the toxins. So you don't want to be consuming that. When we're trying to get rid of the toxins, we get rid of the inflammation.
Great explanation.
Yeah.
And you know, if people want to see more information on that, I'll have a link in the description below to my video where I explain how I reversed 5 cavities in 3 months. And I went through, you know, a lot of the science behind that and what Dr. Weston Price found out, and my own experience, and you know, to show more proof and evidence to support this, and to really see the science of how you can reverse cavities. I was able to reverse cavities even with having a narrow airway, with decreasing the inflammation there through my oil pulling blend, with, you know, boosting the nutritional content of my body through the powder. But also a big part of it was being outside, getting vitamin D. If you don't have adequate vitamin D, one study I read says you can only absorb about 15% of calcium without adequate levels of vitamin D. So, and you could supplement with vitamin D. The sun is actually the primary source. It's the best. There may be some issues with supplementing with vitamin D. Better than nothing, probably. So obviously one thing that people could do is they could hop on a plane and come over and see you, depending on where they are, which obviously is going to be the more expensive, but I mean, that's something that people could do if they wanted. They could actually come see you and have you treat them. Do you want to speak to that at all? Or?
Yeah, so I do have patients who fly in from out of state to receive this treatment, and that attests to the fact that it is a little bit on the rare side to find a practitioner. And I guess one of the things that my patients like about what I do is it's more comprehensive because I address the jaw, myofunctional, the expansion, and the ortho, all aspects of the full scope of airway dentistry. And also I am also holistic, and I'm able to help them in other aspects of lifestyle change as well. So that's a benefit. Nevertheless, there are airway dentists in other parts of the country, and it is increasing. More doctors are doctors who are really motivated to save lives and to who are really concerned about the health of people, are really investing, because it's a huge investment to learn more about this and to learn how to do this. For me, it was a whole career-long path. So you can try to Google search airway dentist, airway-centered dentistry, any other myofunctional therapy or oral myofunctional therapy. Those are some, words that you can use to search that could potentially lead you to a clinician, who can potentially help you in that area.
So you don't want to hop on a plane to go to San Francisco, so there may be someone a little bit closer to you, and this is how you might find them.
You can, and I would be honored if one of Gabe's audiences came and sought me for help. And I will do my very best to take the best care of you. But
she's the best.
Thank
Very
you.
good. Very good.
Appreciate that. Let's start with exercise. I hope everybody can motivate themselves to go out, and I recommend outdoor. I'll start with a story about before and after the pandemic, what I noticed in my patients. The first group of patients that came knocking on my door, like I need an appointment after we reopened, because we were told to shut down for a few months, right? So I shut down for a few months. Patients came right after that were my patients who had the jaw problems, and they were grinding their teeth and they were breaking their teeth, and these things were happening more rapidly during the pandemic. And I kept seeing my patients coming in waves, I guess. My first wave of patients were all the patients who were increased in plaque level, and I try not to tell my patients why I'm asking, just because I want the most organic response possible. And I kept noticing that my patients who stayed at home, cooped up in a corner in front of their computers, for example, working from home, and very anxious and living in fear, and not going out at all, were the ones who came back with lesser dental health, increased plaque level, and increased jaw problems. And so their sleep quality is definitely suffering there. And then I started to see patients who were coming back with very golden skin. Yeah. And I'm like, oh, you've been going out. And I'm like, yes, every day, 2 to 3 mile walk or a run. So younger people are running, or my elderly patients are walking, or they're out camping. So they're going into the woods where it's safer. But they're getting that fresh ionized air. They're getting sunshine. They're getting physical activity. They're detoxing their body throughout the pandemic more than they used to before. And guess what? And I've been seeing these patients for a while, so I know the difference. They're coming back with less plaque in their mouth. Their mouths are clean. I'm able to do simpler cleaning. I started noticing that, and then I saw a group of patients who were exercising, but they were exercising indoors. And they were kind of the same as before. Not much change.
Interesting.
Yeah, and so this is just from my clinical observation. So I started to encourage my patients to exercise more outdoor. So you get a combination of all of the nutritional factor, the pure air and D, and exercise. And my patients who would have persistent gum problems, I would ask them to consider increasing their cardio. And they would increase their cardio. 3 months they come back for checkup, evaluation, cleaning, and their gums look beautiful. So
exercise.
Exercise, yes, is something that I would love to emphasize, but not just indoors at necessarily a gym. Like, and if that's all you have, then it's better than nothing. But outdoor exercise.
Outdoor exercise is the gold standard.
Is the gold standard. Yeah, and really, you know, we exhale carbon dioxide and we inhale oxygen, and the trees do the opposite.
Yeah, amazing.
So, yeah, be close to nature. There's a reason why there's that exchange. That we're supposed to live together in harmony. Yeah. But you do some more research on it. Read more. I'm happy to post my website as an educational resource for everybody.
We'll have that in the link description.
Yeah,
the link in the description.
It's called revivesleepstudio.com. But from there, read some books on it and try to find a practitioner in your area. Tell your friends and family about it, that there is a way to be healthier. And a lot of people who hit rock bottom or hit a wall trying to do all these different regimens and like the weight's not improving or whatnot, you know, this is something that you can tell them about, and people could have more hope. Yeah, or at least answers if there's no therapy being rendered.
Yeah.
And having answers is huge.
Well, Hyun, Dr. Bang, thank you so much for being here.
It was an honor.
This is a blessing. And again, all the information is going to be in the description below, links to your website. And I recommend going and reading the things that she has on there. I hope this has been fascinating, interesting to you. And I would just like to say thanks for watching, and may you be blessed in your pursuit of dental health.